I will never forget the sickening feeling at the bottom of my stomach when 23 years ago, my son was born and the doctor called from the hospital and told me over the phone, which one should never do, that my son has Down syndrome. I didn't know at that moment what to do. I was not prepared for it as an adult. I was not prepared for it as a parent. And I remember a complete sense of helplessness and despair. And the one thought that went through my mind was that God was punishing me for something I did in a previous lifetime. Today, he's a young, healthy, strapping, social, very active young adult. He is a champion swimmer. And last night he called me on Skype and he said that his girlfriend, who came from England, is visiting him in New York, and they both announced on the phone that as soon as they finish their college education, they will get married and set up a household. Wow. My wife's brother, my brother-in-law, was born with a severe disability because at birth he had restricted oxygen flow and has a severe mental disability. He is now 62. He has been married. Unfortunately, his wife passed away. He is living a semi-independent life. He holds a job. He travels around the UK twice a year on holidays and sometimes goes abroad. He is a fully functioning male and has lived a happy and healthy life. Last but not least, my youngest son, who is now 20, was diagnosed in his late teens with dyslexia and dyspraxia. And that happened when the studies in high school, in the last 2 years of high school for the IB program, became too intense, and he noticed that he was slipping behind and not able to absorb all the materials. Otherwise, he was an incredible achiever in school and still is. He's now reading law in Warwick University. He wants to be a business person, and when he told me that he was diagnosed with dyslexia, I said, well, great, congratulations, because all the top businessmen in the world have dyslexia, so my old age is completely assured. Why am I telling you all this? Well, the facts, I think, are clear. The World Report on Disability says that about 15% of humanity has some sort of disability. You are asserting that the number is actually higher, that just the learning disabilities or challenges that you're discussing in this conference, the 4Ds so-called, account for possibly 20% of every society. So possibly we're talking about a third of humanity having some sort of challenge, which makes it the largest excluded, disadvantaged population on this planet. Bigger than the refugees, bigger than national minorities, bigger than religious groups, which tells us something. Coincidentally, you know that this year we are celebrating 10 years since the convention was adopted, which was, I think, in international law, a landmark act that changed the scene, at least for us in the UN, in terms of the attention and the awareness that it created around the issue of disability. It is also coincidentally, recently, 25 years since the adoption of Americans with Disabilities Act, which was the first such profound civil rights legislation adopted anywhere in the world. And by the way, the story about my son, who was born in New York, he actually benefited from the Americans with Disabilities Act, which was passed only 3 years before he was born. 80% of people with disabilities live in developing countries. 2/3 live in rural areas. We estimate that about 60 to 70% of them are undiagnosed, which I think you as educators coming from all over India can probably confirm. Accessibility in these rural areas is either non-existent or very weak, and clearly we all know the link between disability and poverty, and not only because of the medical bills. Officially in India, and you know this better than I do, currently 2.2 or 2.3% of the population is listed as having some sort of developmental challenge or disability. This is because your definition of disability has been so narrow. But we live in a good time. Only last week we've got news that we will have an expanded definition of disability, I think from 7 to 17 indicators. And hopefully the law that has long been sitting in Parliament here in India, hopefully will pass. At least that's what my Indian colleagues and contacts are telling me. So this is a time of some optimism. The fact that you are sitting in this room is also an indication that the educators in India are becoming increasingly aware not only of the problem, but as I've seen in your previous segments and tomorrow, of the solutions that are out there. We estimate that a full 50% of disabilities, if they are detected early and intervened with early, are curable to a point where the disability becomes insignificant. I think the examples that I've used and the examples that you have all in your professional and private lives probably confirm this. The problem is we don't detect it early enough. Even in the most evolved societies, such diagnoses as dyslexia, dyspraxia, attention deficit disorder are still frequently misdiagnosed, are frequently over-medicated, or not detected at all, as was the case with my younger son until he was way in his late teens. Hopefully in India we will get new data very, very soon about the situation with people with disabilities, because hopefully we'll have a census that will give us this information. What about the SDGs? Last year was the year of the global agenda. The summit in New York, 193 countries signed the global agreement. What does it say? We've done a quick analysis, including for you and for my talk here, but also for the World Disabilities Day, and tomorrow, or Monday, I'm sorry, we have a big event organized by DPI where representatives of people with disabilities from 60 countries are flying into Aero City to have an event here in Delhi. Well, first of all, this agenda reflects the issue of disability much more than the MDGs. There was almost no mention of disability in the Millennium Development Goals. This one includes disabilities in goals 4, 8, 10, 11, and 17. 7 out of 169 targets are directly addressing people with disabilities in areas of health, education, and social welfare. And another 6 include people with disabilities among other vulnerable groups that need protection and support. The moment in India, I think, is right. The time is also right globally. We have seen, as I said, an enormous increase in awareness of how people recognize disability, how they deal with disability emotionally, in the health system, in the education sector, and society at large. Frankly, to me, somebody who's went through the story of living with a child with disability for 23 years, the biggest success of the Americans with Disabilities Act is not the money, is not the free schooling, is not the medical services, although that is very, very, very important and certainly lifts the burden of the parents. The most important thing is how it changed people's minds in the last 25 years. The recognition and the attitude towards people with various kinds of inabilities in the United States is frankly amazing. You will encounter kids with Down syndrome, or adults, sorry, with Down syndrome, selling you things in a corner grocery shop. You will find them in a pharmacy, where coincidentally my son now works. You will find them filling cars at a gas station. You will find them in offices. People with physical disabilities and on wheelchairs are a normal sight, getting into buses, onto trains, getting into public service buildings and municipal assemblies. They are everywhere, and the recognition and the support of society is frankly incredible. They are not treated with condescension. They are treated with respect as equal contributing members of society who just have different abilities. I'm using the example of the United States simply because I'm more aware of it than the legislation in other countries. There are similar programs in Europe, in Australia, in other parts of the world, including the developing world. But frankly, I have visited and traveled to 86 countries in my life, and I have not seen anything like the mental change that has occurred in the United States since 1990 towards people with different abilities. They say that inclusion of women into the labor force, on par with men, will add 3% to India's GDP. We don't have an exact calculation, but my assertion is that if we are able to include people with disabilities into mainstream society, we will get another 1.5 boost to the GDP. So to those policymakers who think that investment in health and education sectors, investment in investment in special training programs, into mainstreaming, into early intervention and detection is a burden to society, I think they need to realize that it actually makes economic sense. Because it is much better to have 200 million Indians who are educated, independent, productive, holding a job, and ultimately paying taxes, than to have 200 million Indians who are sitting on the social budget, which will become bigger and bigger the longer this problem is postponed. So I think we are at a point right now where all of us and all of you need to marshal our arguments, marshal our strength, get together in a collective effort to lobby the legislation for passage of the law, lobby the executive for enforcement of the provisions of the law, and frankly, go out there and help people with disabilities lead normal, productive lives. I think people told me that, oh, how unlucky you are, you have family members with disabilities. It must be really tough. I have to say to all of you, I actually think that my family was very, very lucky. Lucky because my kids were born the place that they were born in. And they benefited from an incredible system that allowed them to develop into mature, independent, productive adults who are leading healthy, happy, and included lives. Was that a signal for me to stop? And I honestly, I wish all of you in this room as educators, as parents, as members of society, to eventually at some point reach the same situation where this happens to all of us. Somebody said that the evolution of society is in the way it treats its elderly and infirm. I would add that it is the level of society in how it treats also its people with special needs. So, in closing, I would like to say, let's make this a year and a decade and the Agenda 2030 a time where people with disabilities become people with different abilities. Thank you very much.